exercising can help to reduce your risk of developing complications, which could result, if you do develop a complication, it could result in a labor induction due to medical necessity.
Right.
It may result in a cesarean birth. So it could increase the interventions required for your birth, which could impact your birth outcomes and how you can heal postpartum.
Hey there, and welcome back to another episode of the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte, and the timing of this episode, at least for me right now in this season of life, is perfect because we are talking about fitness before, during, and after pregnancy. And at the time of this recording, I'm almost 35 weeks pregnant. It's going to air on maternity leave, and I'm excited just to have kind of an interview that's kind of focused on this season in my life right now. And I know many of our listeners are over 50, over 60, but maybe you have a child that is pregnant. Definitely share this interview with them because there's a lot of misconceptions when it comes to working out during pregnancy. And I don't know about anyone else's experience, but mine is more so like being pushed to take it easy, push, oh, like have the extra cookie, it's for the baby or it's for breastfeeding. And I think that just openly talking about health during pregnancy has been really empowering this third go around. So I'm excited for today's interview. My guest is Gina Conley. She's the founder of MamasteFit, which is a perinatal fitness training company located in Aberdeen, North Carolina. MamasteFit supports women throughout their pregnancy, birth, and beyond as one of the only training facilities exclusively serving pre- and postnatal fitness training clients in the United States. So Gina has her master's in exercise science and is the author of Training for Two, a book about how to use prenatal fitness to support a strong and pain-free pregnancy as you prepare for birth. Gina is a birth doula who has supported over 200 in-person births. She combines her experience as a fitness trainer and a birth professional to create comprehensive programs that support her clients from conception to birth and through the postpartum period. Gina is a military spouse, an Army veteran, and a mom of four. Gina, thank you for your service and your sacrifice for our country, both actively and as a spouse. One of my dear friends is a Navy wife, and so I know that comes with some sacrifice. And, it's just such a cool calling that you have, too, just to be able to support women in this special season of their life because whew, as you know, it's a whirlwind,
Yeah,
especially at this
absolutely.
time. So I would love for just to kind of start on, what can women be doing to safely exercise throughout pregnancy? Because there's just a lot of messaging around like, oh, take it easy, be careful. Like, are there some real risks to exercising during pregnancy, or are there more risks to not exercising during pregnancy?
So I think a lot of folks take the better safe than sorry approach when it comes to prenatal fitness. Women weren't really included in research studies until the 90s, and so this is like a newer thing that we're even beginning to really understand. And so the kind of approach is, well, just don't do anything and better to be safe than sorry. But you can actually be sorry if you don't exercise because there is a lot of benefits for both you and for your baby. Like some of the misconceptions with exercise during pregnancy is really revolves around the safety of it. So is this going to impact my pregnancy length, such as will this cause a miscarriage, will this cause preterm labor, in addition to like will this impact my baby's development, will it negatively impact my baby's development, cause them to be too small, will my workouts suck all my nutrients to my muscles instead to my baby. And so there's a lot of fear involved with exercising, and I think there's a lot of like old wives tales and like old misconceptions that have kind of been pushed on us from like medical providers at one point, and now they're updating their information as well, but it takes time for people to kind of get up to date with things. And so I know for me, like with my second pregnancy, we had a miscarriage, and my mom made a comment of like, oh, maybe it was you were exercising too much, and I was like, well, that's not actually the case. And so I'm going to start by addressing the common myths associated with prenatal fitness, and then I'm going to touch on what are all the benefits, because there are a ton of benefits both for the mom and for the baby.
Yeah.
So the first myth is, does this cause miscarriage or will it cause preterm labor? And the answer is no. And this has been repeatedly demonstrated in research that it does not increase your risk of miscarriage. Miscarriage unfortunately happens due to chromosomal abnormalities. So there's nothing that you did to cause it, and there was probably nothing that you could have done to prevent it either. And so it's just one of those tragic things that happens to 1 out of 4 women. And so when we put this additional burden of guilt, well, maybe you did something that caused it, it's just really not helpful at all and ultimately not their fault. The next thing is going to be, is it going to cause preterm labor? And I think this might be a misconception because if someone is in preterm labor, the prescription is typically bed rest, like don't
Right.
exercise, don't move, to try to prevent things from progressing, because movement during labor can absolutely help to facilitate the process. However, movement does not cause you to go into labor. Like it can help labor when it begins, but there's no movement that's necessarily going to put you into labor. But if you have a pre-existing condition, then yeah, like exercise may not be like conducive for you. So the reasons that exercise may be like harmful is if you have a pre-existing medical condition where exercising is not recommended for you. This could be like you have respiratory issues, like cardiovascular issues, like uncontrolled thyroid issues. So if you have a pre-existing medical condition where exercise is not recommended, it's going to continue into your pregnancy. If you develop a complication during your pregnancy where exercise is not recommended, where you probably just need to go to the hospital and get induced, such as like severe preeclampsia, like you're in preterm labor, your water is broken, those would all be reasons that I would say like you probably don't need to work out. You should go see your
Yeah.
doctor. Um, and then if you develop complications where like your cervix is maybe dilating way too early or it's really short when it shouldn't be, like maybe you have multiples. So there are conditions during pregnancy where exercise may, the benefit of it may not outweigh the potential risk. And these are conversations to have with your medical provider. If they're saying like, hey, you got a lot going on, maybe we probably shouldn't exercise, like they're probably coming from a good place. Now if you are a low risk pregnancy and there's nothing really, like nothing wrong with it, it's pretty safe to exercise. I would say there's really no inherently dangerous exercises for anybody. Like you can lift weights, you can lift heavy weights relative to you, you can go running if you want, like you can go walking, you can do your normal like aerobic classes, but we want to be mindful of fall risk. So is there a risk of falling during this workout or during this exercise that could potentially be harmful for you or for your baby? And then paying attention to the environment. So if is it really hot? Are you like dehydrated? Like is this maybe not a place that a normal person, like doing jumping jacks in a sauna, not where I would recommend your workouts during pregnancy. I would also not recommend that to a normal person. So just paying attention to your environment and being mindful of how you're feeling during workouts can be a really good clue. But you can lift weights, you can go do cardio, you can swim. Like there's so many workouts that we can do during pregnancy that are incredibly beneficial for us. And there are a ton of benefits for exercise, both for the mom and for the baby. And so I'll start with the mom and then I'll talk about the baby, because a lot of folks don't know all of like the really cool things that are going on with our baby. And I know for like the clients that come to our gym, they're very motivated to do things knowing that it's helping their baby. And so I really love sharing all that stuff. And so for the mom, one, you're probably going to be more comfortable throughout your pregnancy. So kind of the common aches and pains that folks may have during pregnancy, you may not have. So you may not have as much low back pain, you might not have pelvic girdle pain, like you might not have pelvic floor issues, your back is probably not going to hurt. Like you're going to feel much more comfortable during the journey and it's going to help you enjoy it a little bit more. Obviously pregnancy comes with some sort of discomfort, like there's really no overcoming that, but you don't have to be in pain during your pregnancy. And so you can use exercise to help be more comfortable. It's going to decrease your risk of developing complications, especially towards the later end of your pregnancy. So it could help to decrease your risk of developing preeclampsia, which is a blood pressure issue, hypertension, which is another blood pressure thing, gestational diabetes by like 30 to 40%, which is pretty significant. And this is just going for a walk like 2 to 3 times a week. Like that can decrease your risk pretty substantially. And then if we add in a little bit more exercise, like the benefits only increase from there. Obviously, like we don't want to work out like 14 times a week. Like there is a limit to it. Be reasonable with it. But exercising can help to reduce your risk of developing complications, which could result, if you do develop a complication, it could result in a labor induction due to medical necessity.
Right.
It may result in a cesarean birth. So it could increase the interventions required for your birth, which could impact your birth outcomes and how you can heal postpartum. So reducing those risks is like incredibly beneficial for pregnancy. It's also going to really positively impact your placenta development, which I think a lot of folks don't know. So, if you exercise in the first half of your pregnancy, especially like that first 20 weeks, which the first trimester is sometimes a little bit rough. So, if you can't, it's okay. But really emphasize it in the second trimester. This can create your placenta to be more voluminous, so a bit larger. It has more functional capacity. And so this is probably a big reason why it decreases the risk of preeclampsia. It decreases the risk of your baby having IUGR, which means your baby is way too small, which is usually related to the placenta. And so the placenta exercising the first half of your pregnancy is going to help to positively impact the development of it, which plays a huge role in your baby's development. And so, really cool things that go on with your baby is their resilience to stress is significantly increased if you're exercising throughout your pregnancy. It's probably due to them being exposed to controlled stress from your workouts that just makes them a little bit more resilient to it. They have more nervous system development, they have more brain development, like so their cognitive function is increased. And this kind of goes into their first year of life. So, they have improved language skills, they have improved motor skills, gross and fine motor skills. Like they are like starting to babble a little bit more. They're crawling a little bit earlier. They're more resilient to stress during labor and in the postpartum time frame. And so there's a lot of benefits to our baby. Their blood volume is increased, like from if they're working out. When they're born, they are sometimes maybe like a little bit smaller, but their heads and like their torsos are the same size. Their arms and legs are just like a little bit leaner. So they have more muscle mass to them too, which is like pretty cool. So there's lots of benefits both for the mom and for the baby. Really, the only big risk is if you're doing workouts in like unsafe environments. So it's like super hot, it's really humid, you have no water. That would not be great. Don't do anything in a sauna. Like hot yoga, maybe like sit by a window, I guess, if you want to do that. Um, and then if you have any sort of pre-existing complication, then exercise may not be safe. But other than that, it's a pretty safe thing to do. And you're really not limited with what you do. The biggest thing is finding something that feels good for you in your body, that you enjoy, that's motivating for you to do. And you don't have to go crazy with it. You were like, we're just looking for 150 minutes a week of exercise. This can be like 3 times a week. This can be like 4 times a week. Really just aiming for like 20 to 30 minutes. Like every day if possible of like a moderate intensity exercise is going to be really beneficial both for you and for your baby.
Yeah, and I think it's important to note that it's okay if it changes. Like I'm a regular exerciser, have been my whole life. Um, and the first part of my pregnancy, he was sitting so low in my pelvis. And the traditional weight movements that I would do, like Bulgarian split squats or lunges or stuff that might cause tension on like the pubic symphysis, really hurt for like days after. And so for me, it's like I really listened to my body and I modified whatever strength movements I needed to be able to continue doing it. It's like don't just stop because one movement hurts, but like do some experimentation and see what movements feel better. The other thing was walking really hurt during that time frame. So we got a stationary bike so that there wasn't that downward pressure as much through that pubic symphysis, and that felt great. I got a walking pad. I was kind of curious. I usually stand at my desk a lot during the day, and then I walk at like 2 miles an hour once walking didn't hurt anymore. Like once he kind of moved up, I guess, out of my pelvis. Is that considered exercise to you, or is that more mobility since it's like not really in that moderate aerobic zone? It's definitely
I
light.
would say I would say it's still beneficial. Like overall daily movement is still really great for you even if it's not at that moderate
Yeah,
intensity level, but then incorporating some movement that is a little bit higher intensity. So what we're looking for with moderate intensity is you can speak like a sentence before you get a little bit winded. So it's not like you still got gas left in the tank, but you're working hard. Like you're like, all right, this is a good workout. So if I was doing like a slow walk at my desk, like I would still count that as movement. So if
yeah,
you don't do a workout that day, but you walked at your desk for an hour or two, like that still counts to me. Like increasing your overall like steps during the day, just your overall movement during the day is really important as well. Because we're not just, doing our 30-minute workout and then sitting at our desk
right.
for the other like 15 hours of the day. Like if we're moving throughout the day, that's incredibly beneficial as well.
Yeah, I'm huge on blood sugar management, and I've noticed the walking pad was so good for that. Just getting movement throughout the day. Like I didn't work out yesterday, but I walked 4 miles at 2 miles an hour over 2 hours throughout the day in like 30-minute intervals. And that feels really, really good to my body right now. I think, can we speak a little bit more to the mental health impact of exercise during pregnancy? Because for me, work and exercise are like the two best things for my mental health alongside like my spiritual practices. But I think that that's a commonly overlooked thing. And I know that mood changes are very, very common in pregnancy. And I'd love to hear some experience postpartum as well, like how exercise has positively impacted people's mental health.
So, like I was saying before, when we are exercising during our pregnancies to include into the postpartum period, it usually decreases your pain. And if we are not in pain, we tend to be in a better mood. And so that's
Yeah,
something that's like really impactful during pregnancy and especially in the postpartum time frame is if you feel good in your body, it's a lot easier to be in a good mood. Like if walking hurts and just doing daily functional
yeah,
movement hurts, like trying to meet the demands of your day, hurts, then it's going to really impact your mood. And so I think that's like just physically, that's something that's so impactful for your mental health. It also gives you an opportunity to kind of surrender as well. Cause like you were saying, you're going to need to modify during
yeah,
pregnancy. Like you're not going to be doing pre-kids, pre-pregnancy workouts throughout your entire pregnancy. Like you will at some point need to modify. And so when we are learning how to surrender to what our body needs and letting go of our ego, that is really going to serve us really well throughout our
yeah,
day. When we come with unexpected things, it's going to really serve us well during our labor. It's going to serve us really well in motherhood because children have opinions on how they would like to do things. And things don't always go the way that you hope. And so if we kind of have this feeling of giving myself some grace and kind of accepting whatever my experience is, we can get that from our workouts during pregnancy. And I think that's something that really carries over and is not always like recognized because usually it's, okay, what movements can I do for my pelvic floor, for my pelvis, for like for this, for that? It's like, well, there's also a mental aspect of it as
yeah,
well. But I think the biggest thing with pregnancy and postpartum is when we are moving our body intentionally, we are going to feel better in our bodies. We're going to be able to meet the demands of our day, which is going to improve our quality of life and therefore improve our mood and just how we generally feel. Like it sucks to have to pick up your baby when your back hurts, or like I had
yeah,
this like weird shoulder thing because I slept on it weird and like trying to like grab my baby all day was like really irritating. And I don't know about you, like when I am just in like chronic pain, I am just not a pleasant person to be around. And so if that was my everyday in pregnancy and that was my everyday postpartum, I would be in a horrible mood. My mental health would significantly suffer. Um, in addition to when we exercise, we have a lot of feel good hormones that get released. Like
yeah.
that stuff is going to help us feel good as well.
I like to think of it as training to give birth. I really want to have a natural childbirth. I've had two. Um, and the other thing I wanted to talk about was there's a lot I want to talk about. Um, does that, you said I was interested in the stress resilience of the baby, because to me, when I'm doing weights, when I'm actively doing things that I don't want to be doing, that feel hard for my body, I'm like, well, labor is going to feel hard too, Morgan. So this is just kind of like your pre-labor training here. And so it sounds like that the baby is getting that benefit as well, right?
Absolutely. So their like the blood that comes to them and like their heart rate and stuff is not significantly impacted during our workouts, but they're still feeling some of that stress. This is exercise induced stress. So it's in a controlled environment and it really impacts them during labor. And so there is a hormone that we release when we are lower on oxygen and we need some more support. And babies have lower levels of this during labor compared to babies that have moms that didn't work out. And so this is a sign that they are more resilient to stress. They're not deoxygenated, they're not feeling stress during labor, which is going to be really beneficial during the actual labor process. Like one of the reasons that we have emergency cesareans is because babies are no longer tolerating it. And that's
Yeah.
not to like blame anybody for it, but if your baby is more resilient to the demands of labor, and let's say you do have to be induced or you do have a more complicated situation, they're going to be able to handle it a little bit better, which I think is really, really beneficial.
Yeah, I agree. I wanted to dig into strength training a little bit. So pre-pregnancy, I would try to aim for like 8 to 10 reps, 5 to 10, like a higher intensity. And then I was just curious, do you recommend going to a moderate intensity? Do you recommend people stay at a high intensity? Just personally, I try to do like 12 to 15 reps just because that's what feels best for my body from a recovery standpoint at this point. Um, I've noticed that backing off on the intensity reduced any like, the pelvic pain I was talking about. I've noticed muscle recovery takes a little bit longer during pregnancy, so backing off on the intensity helped with that. But what are your general recommendations for people who are already lifting at a pretty high intensity pre-pregnancy? Like, should they modify anything? Should they just listen to their body? What do you suggest?
So my general recommendation during pregnancy is to kind of go for like a strength endurance like rep range. And so this can be anywhere from like 6 or 8 to like the 15 or 20. So it's kind of a big range, but we're going to be decreasing our load pretty significantly. And so this is going to allow you to still lift weights, but at a lower volume. Because if you're only doing like 2 to 3 reps and you're at 70%, that's going to be like way too easy. Like you're not going to work out in. But if you're doing 70% at 8 reps, that's going to be much more challenging, but it's going to be at a load that is manageable for you. So when we're doing like our lifting movements with like a barbell or with like our heavier weights or like our main lifts, we do about like 6 to 10 reps. And
Okay.
then the accessory work is usually about like 10 per side, 15 per side. This is where we get like the higher numbers because these are more like our body weight exercises or resistance band and lighter weights. And so our accessory work volume is going to be a little bit higher. Our programming overall, the volume is very high for it because we're in more of an endurance kind of mindset right now. Because there's a lot of endurance demands during pregnancy. Like we've
That's
got
true.
postural changes that are happening. Like we need the endurance to maintain an upright position. And then going all the way into labor, like we need endurance to maintain an upright position to support our labor process. And then that is going to carry over to the postpartum as well, which I think a lot of folks, when they think prenatal fitness, they think pregnancy and birth and they don't realize that it actually is super helpful postpartum as well. Like whatever you did during pregnancy is still going to be there for you after the fact.
Yeah, and when you say
Sorry,
like
I like lost my train of thought.
well, you said high volume, I think is the word that you said. Can you explain that for people that might not be familiar with that terminology?
So higher volume just means you're just doing a lot more reps than maybe you normally would, or what you may consider like so like a lower volume programming, I would say would be like something anywhere from like 3 to 5 reps per exercise. Higher volume for us is like the overall number of reps that you are doing is the number is much higher than like a different program. So for us, the lifts are going to be like 8 to 12 or 8 to 10 reps, and then accessory work is like 10 to 20 reps. But this is going to be over 3 rounds, 3 or 4 rounds. And so there's a lot of repetitions that are happening, but the weights are going to be much lower than they were pre-pregnancy. And so typically what I recommend for my lifters in the first and second trimester, we're looking anywhere from like a 70 to like 80% effort level with our weights. And this will look different than pre-pregnancy. So it's not 70% of your 1 rep max, it's 70% of what you feel today.
Gotcha.
And so, what we're looking for with the round is as you do every exercise, you're maintaining really good form. You're not compromising in your form. You feel very comfortable during it, but you feel challenged. By the last rep, you're like, I maybe got like 2 or 3 more, but then I'm going to need
That
to
was
put
my
this bar
question.
down.
Yeah, I'm like, okay, are they doing 6 to 10 to failure or to fatigue? Because it sounds like I'm training at a pretty similar load as what you would recommend, but um, I'm doing more. Like I'm doing like 12 to 15 to like that muscle failure where it's like I could maybe do one more, but maybe I should back off a little bit. Is that what you're saying?
Yeah, I would say like leave it to where you can do maybe like 3 or 4 more.
Okay.
But you're on the right track though. You're on the right track. You're still challenging yourself, and it sounds like you're still maintaining really good form, which is the key
Yeah.
thing that we're looking for. Is as long as you are maintaining really good form and you feel very good as you do the movements, like you don't feel like this bar is gonna fall off my back, like I need to
Right.
bail. Like as long as you're not reaching that point, we're usually at a pretty good point. The reason why like the form is really important during pregnancy is we have a lot more movement happening within our joints. The way that we stabilize is different, the way that we manage
Yeah.
pressure is different, and so we cannot lift at really heavy loads relative to you as a person like during pregnancy, because the way that we can manage that is much different than prenatal or pre-pregnancy.
Because
And
you're
all of the
poor.
extra joint and stress on our joints, like if we're
Yeah.
lifting with poor form, is potentially going to cause injury more likely during pregnancy than outside. And we don't want to be injured during pregnancy if possible. It's not a good time to be like trying to rehab from stuff. So as long as you're maintaining good form, you feel challenged, but you think you could do a few more reps before you would need to bail. And then this is where adding in accessory work can be really helpful. So we do like little supersets in our workouts to make it a little bit more endurance focused, but still getting the challenge of lifting, where it's like 10 squats and then you do 10 step ups and then you finish up with some sort of banded exercise. And then you do that 3 times. So that way we're limiting the rest, so we're increasing the endurance, but we're still getting the strength training within it. And then we can also add in a little bit of accessory work. Because something that is really common with strength workouts is everything is very front to back. So we're very much in this like sagittal plane when we're doing like squats and deadlifts, and everything is just kind of moving in this direction. But for our hips to open and to create space for our baby, we also need movement that is rotational. We need movement that is lateral and side to side. And so we can have our strength movement that's that front to back, but then we can add in the accessory work that has the rotation, that has the lateral movement to help support the mobility of our hips and the mobility of our pelvis to support our labor process as well.
Yeah, I think the abductors, so people who aren't familiar, like the abductors is kind of the side glute muscle. And the traditional things that I would do to work that, like some single leg stuff, it just hurt my pelvis too much. So I started doing like banded clams. I didn't know if there were any other accessory exercises that you would suggest for hip rotation specifically.
If somebody is dealing with pelvic pain, something that I really like to do is to really increase activation of the inner thigh muscle that really helps to stabilize the
Mhm.
pelvis. And so I'll have them do like a staggered stance or like a split squat position where
Yeah.
like the feet are in different positions, but just kind of playing around with how wide they can go depending on comfort. And then I'll add a resistance band that's kind of pulling their front leg outwards. So they have some inner thigh
Mhm.
activation. And then as they do their lunge, they're going to come down and they're going to rotate belly towards the thigh to find internal hip rotation. And then they're going to come up to find external hip rotation. Or they can just maintain the internal rotation as they go up and down. We found to be really successful to keep our clients pain free as they are doing single leg exercises if they have pelvic pain. But if you are having pelvic pain with spreading the legs apart, which is pretty common if you have like front pelvic pain, we can think about how can we work these muscles in a way that feels more manageable. So if standing and doing lateral band walks where you're walking side to side is like that's not happening, especially like a single leg planting and like pivoting
Right.
movement is usually not great. Well, maybe we move down to the floor and we try a fire hydrant on all fours and see
Yep.
if adding 2 more points of support helps. If that's still not like, nope, like laying down on your side, doing the banded clamshells. But if spreading your legs at all is really painful, I would put the band around my thighs and I would do a hip thrust where I maintained
Mhm.
my knees being like in one position the whole time. So there's no like abduction happening,
Kind
but
of
we
like a
have
bridge.
that resistance. Yeah. So kind of like a bridge or a hip thrust. So either back is elevated or down on the floor. So we're still working that side glute muscle, but we don't have any of the spreading of the knees that is sometimes really painful. And so when it comes to managing pelvic pain or keeping us comfortable while we were lifting during pregnancy, it's all about just modifying. And so, things that I would do to help modify is can I increase the support in this movement so that I can be more stable?
Yeah.
Because if we are unstable or we feel unstable, we're going to clench and that's going to change, that's going to cause compensation patterns. And we don't want that when we're lifting. So, can I increase the support? So, if you're doing a squat, for example, and your back was kind of hurting, can we squat down to a box instead? Add some support, decrease our range of motion. Can we hold on to rings or onto like the edge of a chair to squat down so we have some support with our upper body can help us a little bit. So those are some like can we lower the weight would be like the next thing that I would modify. So can I increase the support in the movement? Can I maybe decrease the loading? And then the last thing I would do is change the angle of the push. And so this is like a big one if I was pressing overhead, but I felt like a lot of like abdominal coning. So the center of the abs kind of pushing out a little bit more, which is a pressure management compensation pattern. If I was pressing straight overhead, seeing lots of coning, okay, let me come to a seated position. I'm still seeing a lot of coning. Let me change the angle. So instead of pressing straight overhead, I'm going to press kind of 45 degrees in front of
So
me
like
and
a
see if that
shoulder
helps.
press, for example, like
Yeah,
if
like
I did
a,
a press or I could like get on a bench essentially
or
and
do an
do,
incline press
yeah.
instead. Yeah. Or even like a banded one where you're kind of pressing like a landmine press. You're kind of like here instead of
Oh
directly
yeah.
over.
So like
Yeah.
looking forward instead of straight up.
Yeah, so
So
sometimes we just have to change the shape, but still think about what is the goal? Like, what am I trying to achieve with this movement that I could achieve in a shape that is better for my body? So there's
yeah,
lots of modifying, like when it comes to pregnancy.
it is. And I'm a physical therapist. I'm not a women's health physical therapist, but like I have a lot of exercise physiology and personal exercise experience. And, even I get stumped sometimes. I'm like, oh, how can I modify this movement? I have a couple other questions on core, pelvic floor. There was one more, but of course, pregnancy brain, forget it. So, from a core, oh, I know it was giving myself grace. Like, if you're used to living like lifting really heavy weights, there's almost this like fun egotistical component of like beating yourself every time, like how much can I squat today? How much can I bench today? But a really big thing that allows us to be able to lift heavy weights is core strength. And when your core muscles are stretched out, they are not going to be contracting efficiently to be able to help you lift weights. And so I think just giving grace to like, okay, my legs are still strong. My body is literally just changing shape, and I cannot tolerate the same load or resistance as I could when I was, not pregnant and my core muscles were aligned properly and not stretched out. So I think giving yourself grace is important. Um, but what are some of your favorite core exercises? Because that was a mistake I would say I made with my first pregnancy and then a little bit with my second, was not training my core enough. And then after I gave birth, I like tried to contract my abs and there was absolutely nothing there. It was like they were paralyzed. I'm like, oh gosh, I have some work to do, So I'm trying to incorporate some more things, but what are some of your go-to core recommendations for women?
So I think there's a little bit of reframing that needs to happen for a lot of us of what we think of when we think of the core. It's not just floor-based ab exercises that,
Yeah.
the little 8-minute ab like circuit. I think I did that with like, was it P90X or something like when I was in like college. So we need to kind of reframe what we think of when we think of core exercises. And typically during pregnancy, like lots of abdominal flexion, so like crunches and sit-ups are probably not going to be very conducive for us. Like probably not my recommendation. Anything that is going to put a lot of strain on like the front abdominal muscles, I would probably not recommend. But we have to remember that our core is more than just our six-pack abs. It is the entire core, like it is your entire torso, which is going to include like your pelvic floor, your side obliques, your back muscles, like your inner thigh muscles can be included within your core. And so there's so many muscles that are a part of helping you to stabilize. And so if we think about what is the purpose of our core, it's to anchor movement on. And so I want my core to maintain its position as my arms and legs do things, as I walk, as I pick up something. And so if we can kind of reframe what we think of when we think of core exercises, this is really going to expand like what we can do. And so during pregnancy, it is absolutely important to train your core. We should not completely avoid core exercises. I've heard that as a myth of like, don't do any ab exercises or you'll destroy your core. But we need to, again, reframe. My core is not just my six pack muscles, and it is the entire core canister, and we're focusing on maintaining our position. So the three types of movements that I would be incorporating to focus on core training is one of the anti-movement. So I am resisting movement with my core as my arms and legs do things. And so this is where a lot of like banded exercises can be really helpful. So like a Pallof press where you have a band attached to your side and you're kind of resisting a rotation can be helpful. Farmer's carries are just holding weight and walking and maintaining an upright position, especially one sided, can be really helpful, or having two different weights can be super helpful. Bear crawls, where you're essentially just crawling on the floor but keeping your hips level, like bird dogs. All those different movements are going to be really helpful when we're focusing on just keeping our core's position. And all of these, again, are core exercises. Like it doesn't have to be sit ups and crunches. The next thing that we're going to incorporate is rotational movement. And now there is some myth that you should never twist during pregnancy, which would make you be in tons of pain if you never twisted your spine. Like
Yeah.
that would not be a good time. The reason why this is a myth is I think it came from yoga, maybe. If you do like a super deep compression twist where your belly really presses into your thigh, it's going to detach your placenta, which is not true. It would just be really uncomfortable. There's a lot in there to protect your placenta. Um, just doing like a single twist is not going to do that. But a deep compression type twist would probably be really uncomfortable. So I would not recommend that. But you should absolutely be rotating your spine and like twisting within your hips as well, like within reason. I would not go to like my red in any of these stretches just because you do have a little bit more flexibility during pregnancy. But we want to incorporate rotational movements. So these can be like chops or like diagonal pull downs where we're kind of like twisting in the upper body. I would say like Russian twists where like your legs are kind of off the floor. I would not do that because that's really abdominal like flexion
Yeah.
focus. But those can be like two really great exercises that we incorporate where you're either pulling down and across your body, you're pulling up across your body, or even just rotating from side to side with like a band
Yeah,
is
that's
like
a
a
good,
really
like
great option.
standing. That's a good one. That's a good idea.
Yeah. Um, The last thing is going to be a hip extension exercise where we maintain our torso position. So these are our squats, our lunges, our deadlifts. Like these are all core exercises as well.
Mm-hmm.
And to make it a little bit more challenging, we can just hold weight on one side. So we can do a one-sided squat. So now I have a little bit of anti-lateral flexion that I'm avoiding as I go up and down with my body. And so this would be my hip extension focus exercise that is anti. So those would be like the three types of core exercises that I would incorporate. Something that I'm resisting movement, I would say like a plank would be like an anti, but I would probably like move away from that by like the third trimester just because most folks are experiencing a lot of coning in that.
Hmm.
I'm going to incorporate rotational movement, so kind of twisting my body from side to side, either with an up and down rotation or a side to side rotation. I've typically find like a standing position, a half kneeling or seated position are going to be much better than like supine ones for this. And then hip extension exercises where I'm maintaining my position. So like a one-sided squat, lunge, suitcase deadlift. Those could all be really, really great core exercises because we do want a strong core to one, help stabilize during pregnancy. We also want a strong core to support our baby's position. One of the things that can contribute towards like malposition for babies, so they're either breech or they're in a funky position, is sometimes the belly is very pendulous, so it kind of really falls forward because the abdominal muscles are not strong enough to kind of pull the baby in. And so this may contribute towards a breech position. This may make it really hard for your baby to engage into your pelvis. And so having a strong abdominal wall is really important supporting their position, in addition to helping with pushing. Like the pelvic floor does not push the baby out, it's the abdominal muscles and the top of the uterus. And so if we have a strong core to kind of like squeeze and push baby down, it'd be like if you have your tube of toothpaste and you're squeezing from the sides, like the toothpaste comes out. Like that's your core doing that. Um, so we do want a strong core to support us there. In addition, into the postpartum, like you said, like everything that we do during pregnancy is helping to support us in the postpartum time frame in a body that feels really different and new. And if we have these movement patterns and we have this neurological connection from pregnancy, it's
Yes.
going to be much more accessible in the postpartum as well.
Yeah, the neurological connection is important because, just learning how to do these movements, connecting the breath to the movement, that's all neurological. And the research has shown that like those early strength gains are more like neuro gains, where you're like, okay, you're getting muscle memory, your nerves and your muscles are firing more efficiently together. So I 100% stand by that. What about some breath work? That's something I don't know that I did a ton of in my first two that I'm trying to focus a little bit more on now. But to me, that feels like a really good core exercise too, like hands and knees, like almost like a cat cow
Mhm.
exercise. Do you have any favorite like breath exercises for, either hip opening or kind of coordinating the breath with the core, anything like that?
So, diaphragmatic breathing, where we're coordinating our breath to movement, is like the deepest core exercise that we can do. We have different layers to our core, and diaphragmatic breathing is one that really helps to activate that deep layer. And if you can coordinate how you breathe to how you move, you'll be doing a core exercise during anything that you
Like
do,
I'm
and it
doing
helps
this
to really
right now.
enhance your stability. Yeah, and it's
Yes.
also a really great exercise to do postpartum as well. It's like one of the first core exercises that you can do. So if I was going to incorporate my breath to my movement to help stability, to help activate my core a little bit more, typically I'm going to be breathing based on my orientation to gravity. And so if I was going to do a squat, for example, I would inhale to kind of feel everything expand. And so this is energetically lengthening my abdominal muscles so that they can then recoil back in. So it's kind of gathering power. I'm going to inhale to lower down. This is helping to stabilize my spine. And then as I come up, I'm going to exhale to kind of lift everything up and in. So now I have pressure and muscle activation working together to help stabilize my core. And so this is kind of, if you are familiar with Kegels at all, or if you've heard that word before, this is how I would incorporate a Kegel if I ever did it into my workout routine. So I'm going to inhale to come down. And then as I exhale to come up, where I have the harder part of the movement, I'm going to exhale to kind of lift up in that pelvic floor, which would be more of that Kegel type movement or
Yeah,
that activation movement. I would not just do Kegels just by myself, like
that was
just
my
sitting
next
here,
question.
like
Yeah.
Kegel to the beat. Like, please don't do that. A lot of us have very tight pelvic floors, especially very tight back half of our pelvic floor. the majority of people do not do a Kegel correctly. And so if you have a very tight pelvic floor, it is going to be very challenging for your baby to pass through. It's also probably going to contribute towards more pelvic floor issues such as incontinence, like prolapse, like just discomfort within your pelvis. It may be contributing towards pelvic pain if your pelvic floor is so tight and clenched that it cannot function. It's really going to impact how you stabilize
Yeah.
as well because it's the base of our core canister. So if I was going to tell you a movement to not do during pregnancy, I would say don't do Kegels, just like repetitive squeezing. It's not
Yeah.
really beneficial for you. But we do want to learn how to move our pelvic floor with our breath. So if I'm moving with gravity, so I'm lowering in the eccentric part of my movement, I'm going to inhale. So I have that stretching and the eccentric movement of my breath. And then when I'm in the harder part of the movement or moving against gravity, I'm going to exhale to kind of lift up in my
Yeah.
pelvic floor, have that Kegel, pull baby to spine. And this is going to help to increase muscular activation to counter increased pressure from exertions. So those would be like how I would coordinate it within an exercise. And now you can do this in a more relaxed position as well to like really connect with your breath and with your pelvic floor's movement. So you can do it in a supine position if being flat on your back is not comfortable, like a seated position. A tabletop position is going to have more more gravity to it as well. You could do it in a standing position where we're just thinking about, okay, I'm inhaling. I would target more of like the inhale to the back side of the body. So feel like your ribs expand, like your back expand into kind of like the back half of your pelvic floor. And then exhale, think kind of lift up in the front half of your pelvic floor, whole baby to spine. So that's kind of, it would be kind of this like almost like circular pattern as I'm breathing. A lot of us during pregnancy and even beyond tend to have much more compression in the backside of our body, which can impact how our diaphragm moves. And so if we think inhale to breathe into that space, it's going to kind of stretch it. But then for a lot of us, the front half of our pelvic floor has more length to it, and the belly maybe has more length to it as well. And so if we're kind of pulling that in, activating it, it's going to help strengthen our core or the abdominal muscles, especially. So you can absolutely do just breath work as your core exercise. You can incorporate that breath work into all your movements to really enhance the activation of our core. And it can also be like the first thing that you do postpartum to help rebuild your core,
Yeah.
to reconnect with your core after birth.
Yeah, that is the first thing that I do is just breath work, like that diaphragmatic breathing, trying to get the muscles to activate with my breath, and then just slowly, slowly, slowly working back into things. I wanted to ask you, like, when do you recommend women start exercising after birth? Like, I know for me, it felt like immediately, like baby's out, okay, I'm doing my breath work, I'm going for a walk. But like a lot of people will say, wait 6 weeks or something like that. What do you recommend?
So I think that you can absolutely begin to reconnect in the early postpartum. So like the breath work, mobility. Like we don't want to just be like perfectly still and like just exist for 6 weeks. Like 6 weeks is too long to do nothing, but it's also too short to like rush back to the gym and like start doing our normal workouts again. So we have like a free early postpartum recovery course that kind of guides people through like the first month postpartum. And I would recommend gentle breathing, just reconnecting, like reconnecting that mind body connection again. Where is my pelvic floor? Where is my core? Where is my body? Now that I don't have a baby in here anymore. Doing gentle mobility, so like lots of thoracic mobility, lots of hip mobility. Just we
Yes.
get kind of stuck in positions after we have little babies because we're just kind of snuggling them,
We're
and we
sitting a
get stuck
lot.
a lot. And you're
Yeah.
like, oh, my back really hurts. And so doing some gentle mobility to feel more comfortable. I would say around like the week or 2 week mark, going for like walks can be really great. So the first week, I would say try to stay off your feet as much as you can. That may not be realistic for everybody. For those of you that are listening, if you have a daughter that is giving birth and she wants you there, I would go to her house and like help her so that she could just rest in bed. That's like the best thing that my mom did for me. So if you can be off your feet as much as possible the first like 5-ish days, that's really great. Because this is our initial inflammation healing phase. In addition to this is where the placental scab is going to come off, and there may be like a little bit increased bleeding around. It's anywhere from like 7 to 14 days that happens. Once that happens, going for like short walks, I would say like 10 minutes, like 5-10 minutes. Like we're not going to go run a marathon on a week postpartum, but going for walks just to get some fresh air, get some sunshine, like move. I would push baby in a stroller over baby wearing at this point just to kind of decrease the load on my body. But if you want a baby wear, that's fine too. Um, and then we can start incorporating like gentle core exercise. And I'm talking like you're on the floor, just one arm is like extending overhead and you're keeping your position. We guide folks through like these really gentle core exercises and it's a free program as well. We offer it as a thank you to all of our followers. But yeah, and then once you kind of hit like 4 to 6-ish weeks, maybe 10-ish weeks, your bleeding has stopped. You're feeling like, all right, I feel like ready. We're also at a different level of tissue healing at this point. The tissue maturation is starting to become a little bit stronger around like the 4 week mark. This is when we can start to incorporate like more structured exercise. So before this was just kind of like go with the flow. Now let's start incorporating like structured workouts again. And they may only be 10 minutes. Maybe it's 20 minutes. Maybe it's 30 minutes. Maybe you have childcare and you can do a whole hour. So we're going to kind of ease into it at this point and think like you're a brand new like a brand new lifter, brand new exerciser. You're on ramping into this program and we're going to kind of ease into it. And so we have a postpartum program that just slowly guides people through this process. It's still challenging, but it's very manageable. We've been training clients in person that are pregnant and postpartum exclusively. We don't do general population programming. And so like we just kind of like walk folks through that process. But you're gonna think, can I find really supported positions to reconnect with my body as I start to move, like a little bit more challenging, and then just slowly adding on to that over however many weeks. So it's not gonna be pre kids, pre pregnancy workouts right away. It's gonna be slow. I find that the more intentional you are with this process, the better. You're going to heal faster. If you rush it, like you try going back to the gym at like 2 weeks postpartum, you go back to the gym and you're starting to like really crush the weights right away, you're probably going to have more issues. Like I've worked with some really high level athletes that were like, Gina, I'm just going to go back to my workouts. And then at month 4 postpartum, they're coming back to work with me because they're like, just kidding.
Does
I
that increase
rushed
the
it
follow-up
and now
time?
I have to start all over again. So yeah.
So if you go too hard, does that increase the risk of prolapse, like uterine prolapse, for example?
I think so. I think it can cause a lot of issues for you. It can make it harder for your diastasis to heal sometimes if you are moving in a way that is really inhibiting that healing. It's potentially not giving your pelvic floor time to heal. It's similar to like if you like sprained your ankle and then you like rested for a week and then
Yeah,
went back and then like you hurt your ankle again. Our tissue is still in a healing phase. And so if we're
oh,
doing too
I
much too
remember.
soon, we're going to injure ourselves and then we're going to start all over from the beginning. I think a big thing with approaching exercise during this perinatal time frame during pregnancy and the postpartum is a lot of reframing what our goals are.
Yeah.
For me, with my first baby, I was an Army officer. I identified as an athlete. This was who I was. And when I didn't have my workouts, I was like, who am I? Like, what is my value now if I can't run fast or I can't lift heavy weights? And so it's about reframing what is my goal right now. My goal is not to go to the CrossFit Games. I mean, it never was to go to the CrossFit Games, but my goal is not this like huge athletic feat. It's to move through my pregnancy to support my birth, to support me postpartum. It's to move through my pregnancy to be comfortable, to feel good in my body. And so that's my goal right now. My workouts are going to look different because that's where I am. I am not any less valuable because I don't lift as much weight. I'm not any less valuable because I don't run as fast. Like, who am I? I'm not trying to prove anything to anybody during my pregnancy. I'm just trying to feel good for me and for my baby. So we can kind of reframe like what is my value in regards to my workouts. It's really helpful during pregnancy. And then that carries over postpartum. Hey, I really want to get back to lifting. It's been a year. Like I haven't been able to lift the weights that I want to. Like I'm so excited to get my body back to feel like me again. And it's hard to be patient in that process. It really, really is. But I really encourage like our listeners and their children to like really consider being patient with the process because it's going to be very helpful long term. Like when you take your time and you're very intentional with the recovery, you're going to feel much better in your body and you're going to get back to that stuff that you really want to much quicker than if you rush the process in the beginning. And I've worked with so many clients over the years who have rushed it and then they come back and they're like, I'm still dealing with all this pain and discomfort. And I'm like, let's work together. Let's figure it out. And so there are resources out there for folks. It's a little bit of reframing that needs to happen. It's like think about what our goals are for this phase during pregnancy, during the postpartum. Right now, for me, I'm just trying to meet the demands of motherhood. I want to feel good for my body, in my body, as I take care of my children, as I move through my day. Like, I think maybe I'll start training for a marathon. I don't know. We'll see. But I'm thinking about what my current goals are. And it's okay if it doesn't look the same as pre pregnancy or pre kids. This is a phase of my life and I just want to feel really good at it and I want to help other people feel really good in theirs too.
Yeah, and I think for me, a mindset shift is like you had an injury. Like, for me, it's like, okay, baby's out. I'm back to normal. And it's like, no, 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 no. Your pelvic floor and your core have had an injury, like you said. And so instead of treating it as like, okay, I'm going to hit the ground running and get my body back as fast as possible, it's like, I'm going to allow myself to heal because for after my second one, I remember at 3 weeks, I don't know if it was 3 weeks or 3 months. It was three because I like did like a run walk for 3 miles. And I was like, I think I feel a little bit of prolapse. That was probably too much. And it was almost like this little scare of like, oops, you need to back off and be very mindful about retraining your core and like re-strengthening the pelvic floor and getting that in place first so that you can run, so that you don't have incontinence, so that you can lift heavier weights. But like I think that'll be my focus coming out, is like rest and repair, work on the core and the pelvic floor. And then like you said, just comfort, mobility, like that stuff feels so good when you're sitting a lot breastfeeding. um Circulation, just like there
Yeah.
there can be some swelling, so just like the gentle walks. I'm really excited for it, but I think I'm going into it with a better mindset than ever this time. um when it comes to the rest and repair, it's not an excuse to do nothing. It's like you're still doing things, you're just being intentional about what you're doing and
It
why.
just looks different. I saw someone explain it once that you have 4 to 6 weeks that you're healing from birth, which is planned trauma. Like we are either having a vaginal birth or a C-section, but the first 4 to 6 weeks is we're healing from that event. And then the next like year is healing from pregnancy. Like pregnancy does a lot to our bodies. There's a lot of
Yeah,
tissue change that happens. And so while you may not see the same signs of birth still, you are still recovering for several months
yeah,
after pregnancy. And
that's
the biggest thing is the tissue healing timeline is very slow and it's very long. And if we rush it, it's really going to impact us long term. Like,
yeah,
it's really going to impact us long term. Like, so please take your time. You don't have to be small to be happy. Like,
yeah.
you can feel good in your body. And it's, yeah, your kids are not going to care if you fit back into your jeans at 6 weeks postpartum. I don't even wear jeans anymore because why? Like, they will not care.
Mhm. That's funny. I have a few more questions for you. So the first is, for me, especially really getting ready for birth, what exercises would you suggest for creating space in the pelvis for baby to come out and like being sure that pelvic floor can relax?
So we have a free birth prep guide that I'll send you as well so that you
Yeah,
can
that'd be
do over
great.
the next few weeks. But with our birth prep guide, these are the exercises that I would recommend someone do if they're going to do nothing else to help support their baby's position, to create space within their pelvis, and to relax their pelvic floor. So it's 6 movements within it. The first thing that we're going to incorporate is during pregnancy, we have some common postural tendencies. So there's certain positions that we like to be in just based on how we're kind of balancing ourselves. And one of them is a very extended spine. So we're kind of arching in our back as belly kind of pushes forward. And this is also going to kind of tilt that pelvis a little bit
Mm,
more forward as well. And we tend to favor more external hip rotation. So toes are pointed out a little bit more. We're just making more space for our baby. There's nothing wrong with this posture. It's just how we're kind of shifting the way that we stand. But with this posture comes with some muscular imbalance. And so the back side of the body tends to get very tight, the back half of the pelvic floor tends to get very tight, and our ability to find internal hip and pelvic rotation becomes more challenging. And these are all movements that are important to creating space within our pelvis. And so in our birth prep circuit, we start with some back expansion exercises. So you're going to find a really rounded position and just kind of breathe into your back space. Anytime somebody has back pain or just like they have like shoulder pain or something is going on with their back, we bring them into a back expansion exercise, either all fours, standing, like all there's so many different positions that you can do. The next thing is going to be lat release exercises. So can we just release the muscles in the backside of our body? Like that's going to help you find a more rounded position, and then releasing the hip flexors as well so that we can bring that pelvis more backwards. Um, all of those movements are going to be really helpful to helping you find a more tucked position, which is going to help baby enter into the pelvis, in addition to make finding internal hip rotation easier because our rib cage position and our pelvic position is really going to influence how you can move your hips to create different types of space within the pelvis. The next movements are going to be hip shifts, which are we're bringing the belly a little bit more towards the thigh. And so it's if you think about like a bowl on top of like a pole, it's kind of like your pelvis is kind of rolling
Mhm.
around on that femur head. We're thinking like, can I bring that pelvis more towards my hip? This is going to stretch the posterior pelvic floor, so it kind of shifts the tailbone a little bit towards the other side. So stretch that back half of the space. For our clients that have like tailbone pain, SI joint pain, low back pain, anything back there pain, a hip shift is like super helpful to kind of releasing some tension back there. Like if someone has like issues with constipation, if I'm standing in line at Disney World for too long, I'll do a hip shift to like help
Mhm.
release my back. They're like a crowd favorite in our gym. We incorporate two different types of hip shifts in the circuit. We have an all fours one, which is a little bit more supported, and then a standing one. But both of these are going to help to create space in the lower part of our pelvis where you may encounter more late labor stalls, in addition to releasing tension in the back
Mhm.
half of our pelvic floor, where a lot of us tend to hold a little bit more. So those would be kind of the exercises that I would be looking at. Can I release my back? Can I release my hip flexors? And then can I find more internal pelvic rotation to release tension within the pelvic floor? So those would be like my, like, if I was going to do nothing else, that's what I would do.
Yeah. Email that to me so I can start doing all of that and be sure that
Oh, I'll send it to you right after this.
thank you. Thank you. I'll use it. All right, a couple more questions to wrap up. I've had two natural childbirths, so I haven't had personal experience with a C-section, but would your recommendations for recovery differ if someone's had a C-section versus a vaginal birth?
So all birth is birth. So whether you had a vaginal birth or a C-section, I would still consider you postpartum.
Hmm.
But C-sections are a major abdominal surgery, and if you labored and then had a C-section,
Yeah,
that is going to be really different than like a
yeah,
scheduled C-section. If you pushed for like 4 hours and then had a C-section, that's going to be really different to heal from. So you can also have a more complicated labor with a vaginal birth, like if you had postpartum hemorrhage, for example, like that could
mhm,
really impact your healing as well. So the main thing is if you had a more complicated birth, so either a hemorrhage or a C-section, your timeline is going to be a little bit extended. You're probably going to be close to like the 6 to 10 week mark before you're really returning to exercise. Now I have had C-section clients that feel really good at the 4 week mark and they want to start structured movements, and I'm never going to kick anybody out of the gym. But I would say in general, most folks are closer to like 6 to 10 weeks before they resume like structured exercise. But all of the beginning stuff is really similar. We're focusing on diaphragmatic breathing. We're doing some gentle mobility. With the C-section, the biggest thing is we sometimes get very guarded, where we get like almost like hunched over because we're scared to stretch the incision site. And so a really helpful thing after a C-section is to learn how to extend again and stand up and kind of stretch gently like the front side of your body again and feeling comfortable there. So that can be like really challenging. Another thing that can be really challenging with a C-section is if you have to cough, sneeze, laugh. Pressure
yeah,
against the incision is going to be very painful. So having something like a belly band or something that applies external compression can be helpful. Not something that restricts your breathing, but just some to
hmm,
give some counter pressure can be really nice. And then if you do have to increase pressure suddenly with laughing or sneezing or coughing, placing your hands against the incision can help you feel like things aren't just going to bust out. So those would be kind of like the main things that I would do differently after a C-section is focus on trying to stand up and should be straight again, maybe stretch, find a little bit of an extension again and feel comfortable there, and then learn how to splint in case you do have any sort of you'll probably cough at some point after, laugh at some point after you give birth, and then just be patient with the timeline. It's going to take a little bit more time. In addition to, we're going to incorporate more mobilization work as well, scar mobilization. So around from when you give birth, whenever you feel comfortable, to around 3 weeks, you could do desensitization around the scar. So this will be like using your hands, your different types of textures. I would avoid like temperature stuff, so hot or cold, just because the sensitivity of those tissues is a little bit different. So you may not recognize that something is too hot or too cold. But you can use like a makeup brush, a Q-tip, like some silks, different types of fabric just around the site, which is going to help you kind of reset like the sensation there. And so if you're having issues with like numbness or having issues with like sensitivity, if we can kind of overstimulate the system, it essentially resets itself and can be really helpful for that. Once you hit like 3 weeks, you can start to do work like on the actual incision with the desensitization. So like the Q-tip on the incision, obviously being mindful that you're not like hurting yourself or anything. It
hmm,
should be very, very gentle work. You're not moving tissues at all. You're literally just touching the skin. Once you hit 3 weeks, you can also mobilize or actually begin to like move the tissue around it. So not directly on the incision yet, but we can start doing like little circles. We're kind of moving like the different fascial layers around. So your skin layer and then maybe like a little bit deeper than that. And then once you're kind of like 6 to 12 weeks, we can start to mobilize on the actual scar. And so this is going to be really, really important if you've had a cesarean birth, similar to any other surgery. When we have tissue that's being surgically cut like that, we need to mobilize that tissue. And this also applies if you had a perineal tear or like episiotomy, like mobilizing the pelvic floor tissue is going to be really helpful as well. So that's kind of like what I would incorporate that's different within that first like few weeks postpartum. For our C-section clients, once we make it back to a structured exercise, we incorporate a lot of rotational work to the front because the C-section essentially severs the fascial line through the front side of our body, known as your anterior oblique sling. So it's like your chest, your oblique into your opposite inner thigh. So it kind of makes like an X across the front
Mhm.
side of your body, and that gets severed right where your baby was born. And so there's a lot of reconnection that we have to like rebuild through there. And so a lot of that rotational work that we do during pregnancy, like the pull downs that are diagonal, the upward chops, the side to side rotation work, we're incorporating a lot of that into our C-section recovery program to help our clients reconnect. And we've had a lot of success with helping folks be like, I couldn't feel my core for 7 years and I did this and now I feel so much better. So just incorporating like that rotational work to the front is super, super helpful post C-section as well. But other than that, all the other exercises are the same, just like the initial time is really different. And
Mhm.
then a little bit more emphasis on certain types of movements is like really beneficial. So yeah.
Yeah, I'm excited to try those core ones. I haven't done that, and I will. And the other exercises that you're going to email me. Okay, last question. Um, I have a friend who's pregnant. She's very, very petite. Um, do some people just have like a pelvis that's too small for a vaginal birth, or like can you mitigate that somehow?
So there is really unlikely for you to have like your pelvis be too small or your baby be way too big for you. Like we
Yeah.
tend to not grow babies that are too big for us. The only reason why your pelvis may be way too small is if you had any sort of like childhood injury that
Mhm.
impacted your pelvic development. So if you had like rickets or like you were in like a severe car accident that like your pelvis was like all fused together,
Mhm.
those would be things that could maybe make your pelvis a little bit too small. It's important to know that during pregnancy, the mobility of your pelvis significantly increases. And so the diameters and the space that you can create during pregnancy and labor is significant compared to outside of the phase of life. And different movement patterns can kind of change the shape and the orientation of your pelvis to help make more room for a baby.
Yeah.
And so a lot of folks sometimes think that the pelvis is like this immobile bone. It's just like a tube that baby just kind of squeezes through. There are different joints that attach it, and like it's
Yeah.
not like your hip joint, but that moves. It creates space. There's increased diameter, and they see this in research. So your pelvis is going to be more mobile. The next thing is your baby's head is a shapeshift. It shapeshifts. It doesn't just like it's not a watermelon just like shooting through. It's a little skull that's not fused, and so it kind of smushes and cones. And I'm sure you've seen your baby come out, and you're like, what is that? That's why they put the little hat on the baby when they come out. Um, but your baby's skull shapeshifts as they move through. So they're going to kind of fit and squeeze and make it through. So we've got two things really working for us where your pelvis is very dynamic and it increases space based on the movement that you're doing. And then your baby's skull is also very dynamic and it smushes and fits through the space as it needs to as well. So I am not a believer that somebody's pelvis is too small. I'm not a believer that your baby is going to be too big for you. I'm a believer that sometimes we have mobility issues that we can be working on during pregnancy to help increase the space of our pelvis. And so, like I talked about with those birth prep exercises, if you
Yeah.
have a really hard time finding a rounded position and you have a really hard time finding internal rotation, it's going to impact the space that you can create within your pelvis. If your pelvic
Yeah.
floor is super tight, it's going to be really hard for your baby to pass through. And the next thing is your baby aligned to that pelvic level? And so if you think about like a square peg with a square hole, if I put the square as a diamond and I try to put it, it's not going to fit. And I'm
Mhm.
going to be like, oh, this block is too big. When really all I needed to do was turn it and then it's going to fit through the hole. It's the same thing for our baby. If they're not well aligned to the pelvic level, they're not going to fit. And there's different movements that you can do during labor to help them kind of
Mhm.
rotate to find a better position so we become a square peg to a well aligned square hole. So yeah, if you're small, if you're big, like whatever your size is, I don't believe that your pelvis can be too small. Outside of extenuating circumstances, like you had an issue, like an injury or an illness as a child that impacted your pelvic development. And unless you have like uncontrolled gestational diabetes, your baby is probably not going to be too big for you. There are people that have birthed like 12-pound babies vaginally with no tearing. Like that's not super
Right.
likely, but I mean, that's not a common thing that happens. But I had a friend that gave birth to her baby in her bathtub that was over 10 pounds. Like it was a planned home birth. Like, so you can give birth to large babies. You can have small babies that have harder times fitting through the pelvis. So baby size is not a great predictor of whether or not they'll fit.
Okay.
Your body size is not a great predictor. If your provider does like an assessment with you on your back with your hips super wide and they're like, your pelvis is really small, that's not a great predictor either because the pelvis is dynamic. Movement is going to change the shape.
Yeah. It's so cool. I could talk to you forever. But can you let people know where they can learn more about you and your services? And thank you for indulging me in some of my personal questions as I can prepare for birth and, cross our fingers, everything goes well.
So you can find us on Instagram. You can find us on YouTube at MamasteFit for both of them. So it's like Namaste, but with an M at the front, like Mama. We offer tons of free resources there. We have like a bunch of freebies and stuff on our pages there as well. We have paid courses. So we have childbirth education and pre and postnatal fitness on our website at mamastefit.com. I have my book, Training for Two, which is a great resource. Great baby shower gift, I think.
Oh, yeah, that's a good
Would
idea.
highly recommend it. In the book, there's tons of exercises, QR codes to videos. So if the pictures aren't clear enough, you can watch a video where I walk you through it as well. So we offer a lot to help support folks throughout this time frame. And yes, that's where you can find us.
Thank you. I appreciate you coming on the show, and you're just a wealth of knowledge. So I'm excited to check those resources out and do the preparation exercises you're going to send me.
Yeah, absolutely.
All right. Thanks. Have a good rest of your day.